so that when you take your next breath in, you're ready to exhale and fold. Reach out.
We spend a lot of time focusing on other people and taking care of other people and not necessarily ourselves.
Come on now, Stretch.
We as women of color, and specifically high-achieving women of color, we need to be okay with saying we need help.
Are we killing ourselves?
Slowly but surely.
They are among the millions of African American women all across the country who are sounding the alarm about their health and their health care. While the data shows African American women are becoming more physically active, the statistics are still dismal. Compared to white women, Black women are 30% more likely to die from heart disease. They're twice as likely to die from a stroke and twice as likely to be obese. And they're twice as likely to have diabetes. Overall, Black people are 10% more likely to report experiencing serious psychological distress than white people, and that's according to the Department of Health and Human Services, their Office of Minority Health. It has become an area of study that's called the weathering effect, which harms the individual's health through repeated exposure to socioeconomic adversity and discrimination.
It's a concept that looks at African American women in particular and the level of stress that we endure over our lifetimes that leads to our early death and leads us to develop health problems sooner in our lives.
So let's talk about this onboarding process. Coaching, consulting, doing some strategic work with women CEOs. That's what the day consists of. If I get a chance to eat, I'll squeeze in some food.
While directing her clients on how to reach their next level, Dr. Monte also realizes she is in the number with most women of color, helping others meet their needs while many times not prioritizing her own.
It's definitely been a challenge for me because everyone sees me as having it all together. Everyone sees me as the strong person. Everyone comes to me with their problems. And so I wake up some days and I'm like, well, who do I go to?
Compound those issues with the public health pandemic of COVID, and African American women across the nation are feeling the knockout punch on their personal health.
What we heard from women is we never got a chance to rest. We never got a chance to breathe. We never got a chance to really stop and process. So now we're bringing all of that stress, that tension, the exhaustion of taking care of other people. Now we have to go back to work, back to life. And so, that's taking a toll.
We need to do the research to see what's going on in our communities and other communities and what resources are available. That's what got us started.
We recognize that when you are looking for health care in this county, it's very challenging, very difficult. We just couldn't find where do women actually go when they actually need certain health services. There's just not a suppository of that information.
In Mecklenburg County, it led to a healthcare initiative launched by women. In partnership with UNC Charlotte, a directory of services for physical and mental health is being compiled, designed to aid women of color navigate the healthcare system.
I'm hoping that they include an evaluation piece as people go out to these different offices and organizations and agencies, that we have a chance to see how they really treat patients. I think that's important because the relationship between a patient and a doctor can either heal you or kill you.
The outreach effort will be housed at the Mady M. Smith Women's Health Equity Institute, named for the county's first African American health supervisor who championed the advancement of blacks in public health. According to Emmanuel, the ultimate goal of this institute is to provide information on the health of black women in Mecklenburg County.
Not just what the data say, but our lived experiences that we are going through, that we actually can come together and be able to navigate together those resources, both physical health as well as our own mental and emotional well-being, which is often sometimes left out.
The initiative has garnered the support and backing of the Council on Black Health, which has monitored and reported on this issue nationwide for the past 2 decades.
This type of event and this activity and this institute provides an opportunity really to focus on women, and particularly Black women, and to really think about what makes a difference in improving health in Black women.
We certainly have an in-depth experience that really is misunderstood, and we have those areas of health inequity that happen to do with just us being Black women in America and just not understood.
And as for that myth of the super Black woman in a cape caring for everyone, well, the coach has a few words.
We need to be okay with accepting help and it not feeling like it's taboo for us to lay down that cape.
For Carolina Impact, I'm Bea Thompon reporting.
We hope you enjoyed the story. If you don't want to miss any more great stories about the Charlotte region, please subscribe to our YouTube channel.